No one wants to live with chronic pain, yet so many people do.
And Dr. Tim Weir of Weir Wellness is here to explain a technique that can help. Dr. Weir, what is the, well, first off, what do you have here?
This is Fred.
Oh, that's Fred.
Yeah,
Fred.
This is Fred. Fred's been with me probably for 18 years.
Oh, yeah?
Yeah.
Did Fred not pay his bill or something?
Didn't pay his bill.
Yeah?
So we got it out of him somehow.
What is the NRC technique?
NRC is Neurologic Relief Center technique. I've talked about it before, but I keep hearing about people who are in these intense pain patterns, and they just can't get out of it. Whether that's fibromyalgia, lupus. I just had a patient came in with lupus and scleroderma across the belly, and it's where the skin actually gets tough and very hard and eventually goes into the organs. And we have done 2 treatments with her, and I would say it's 90% better.
Wow. 2
treatments.
That's it?
Yeah. And so the whole technique is based upon the brain, which sits up in the skull. The spinal cord comes through the center of the skull, and there's a covering around that called the meninges. And that meninges gets stuck right in here, and when that does that, we get all kinds of symptoms that show up, whether we call it fibromyalgia, lupus, rheumatoid arthritis, whatever it may be, but we get this incredible pain. So what we do is we've come up with a test that literally takes that compression out of there for a matter of 5-6 minutes. And in that period of 5-6 minutes, I see these patients, if they're going to respond to the technique, they go from a 10 pain level, sometimes down to a 0, very often to a 1 or a 2.
That quickly?
Yeah, within 5 minutes. And I always tell people, because doctors, I talk to doctors all across the country, I teach part of the technique. So I tell them one of the first things that you have to buy for your office is a big box of Kleenex. Because you have these people who sit up from a table who for 20 years have had pain. They sit up and they have absolutely no pain, and they just begin to sob and they cry.
So how does a person know if this will help them?
This test. Okay. Within 5 minutes, I'll know whether I can help you or not. And what I do is I repeat that test twice, because I want to know beyond the shadow of a doubt that that is what is causing the problem. If it is, I don't care what you got. Nothing else is going to help. You know, so many people are on so many drugs. My God, if you saw the drugs people are on, it's just unbelievable. And if you don't have to be on those drugs, wouldn't that be life-changing?
Absolutely.
Yeah, and so just a couple minutes in your office could change their lives.
And guess what? It's free. I don't charge for that test because I want to know whether I can help them or not. If I can, yay.
And so once you can decide you can't help someone, do they need to come see you repeatedly to get relief?
So we put them on a schedule of visits because we have to retrain that area. Now, and see, people say, well, I'm a chiropractor. Well, I've tried chiropractic in the past. Well, it's not the same. Chiropractic works, and thank God for chiropractic, but this is totally different. It's a totally different technique. So if you haven't tried this, then you haven't tried it, and you got to try it.
NRC, and it's pretty common among chiropractors?
No, only 250 of us across the country.
Okay.
So.
You're one of them.
I'm one of them.
Bad news, I don't think Fred's going to make it.
Well, I told him that too, but he still wanted to come.
If you guys want to get in touch with Dr. Weir, go by and see him, or you can do it all online at weirwellness.com.